Welcome to Healthcare Master Data Management. Fix the data, lead the future. I'm Kanisha Ward, also known as Kay, your moderator today, and I'm thrilled to be joined by two industry leaders who are shaping how organizations think about data strategy. Rohit Singh Verma is a recognized global leader in data and AI, serving as Senior Director of Data Practice at Nvizion Solutions. With over 20 years of experience across healthcare retail, banking, manufacturing, and life sciences, he helps organizations leverage data as a strategic asset to drive measurable business value. A certified MDM consultant and frequent speaker at Gartner, Forrester, and Informatica World, Rohit has led high impact data and AI initiatives for Fortune 500 companies. His deep expertise in healthcare enables organizations to unify patient, provider, and operational data, improving accuracy, compliance, and decision making while advancing patient outcomes and operational efficiency. And Bridget Tebow, a nationally recognized healthcare strategic advisor with over 20 years of experience in master data management, data governance, and is well known for implementing healthcare interoperability fire standards. She has led large scale MDM initiatives, improving provider, patient, member, and location data standards across major providers and payers. A frequent national speaker and advisor, Bridget has developed proprietary MDM frameworks for her clients across the nation. Passionate about transforming patient care, she brings meaningful change to the healthcare industry by standardizing data to improve the patient experience and elevate the quality of care. Help me in welcoming Rohit and Bridget to our segment today. So we've got a packed hour ahead of us today. We're super excited to dive in here. So let's start with why master data management matters everywhere. So Rohit, before we narrow into healthcare, could you help us paint a picture of why master data management has become essential across industries?
Well, thank you, Kay. Thank you, Kay, for the wonderful introduction. And hi, Brigitte. It's been lovely to meet both of you. And yes, I think you have asked a valid question, Kay, that why MDM is required for all the industries. As we know, that with this kind of data and systems world right now we are living in, there is a huge explosion. I mean, if you see around that most of the organizations, they are relying upon different ERPs, CRMs, marketing platforms, and then all these platforms are keeping their own version of data, whether it's your customer data, whether it's product data, supplier data, or in healthcare like provider data or patient data. There is so much data is everywhere. But what about if you want to have a unified version, if you want to have a single version of the truth of this data? If you don't have an MDM, you will always struggle with this fragmented data. And that's where MDM is absolutely essential in each and every industry. Because when you have such large amount of data, you need a centralized place. You need a placeholder where you can keep all this information at one place, which is reliable, which is truthful, so that all your organization can rely upon that information. It becomes a single authoritative, single version of the truth. So that's why I think MDM is absolutely critical, whether it's any kind of an industry. Okay.
Beautiful response, Rohit. And if you could sum up what master data management is for our newbies out there to this segment, what would you sum that up as in 1 to 2 sentences? What is that? What does MDM mean for you and newbies that are out there?
Well, see, if you talk about MDM, and it's just talking on a layman language, MDM is just a way to clean this record and make a unified layer, make have a data in a one place where data can be, that you can trust that data. That is called a single version of the truth. And it's not only about making sure that you're just doing the duplicates. It's a whole journey altogether. If I talk about a typical master data management approach, you typically, first of all, you need to understand the data. That's why data profiling is extremely important. And any MDM tool or any master data management concept is not complete without data profiling. Once you have profiled the data, once you have cleansed the data, once you have understood the data, then next comes the layer where you do the deduplication, where you do the fuzzy and deterministic matching, basically identifying that if any duplicates are residing. So there is a way to make sure that those duplicates are removed, because The ultimate goal of any MDM system is to make sure there should not be any inconsistency, there should not be any duplicates in your golden record. After that, you have to have some kind of data governance regulations. As we know that especially if you talk about healthcare, there are regulations like HIPAA regulation, GDPR. So MDM should have a capability to have these regulation also in check, so that you can make sure that you're not paying these heavy penalties to the government. So MDM, as I said in a nutshell, is a program which will make sure that your data is in a place where you can start relying on that data. It's absolutely clean, it's standardized, there are no duplicates present, and it's also respecting the government norms of the regulations. And after this, you can see all your initiatives, whether it's AI, whether it's your analytics, whether it's any forecasting, everything will be successful if your data is cleansed. So data becomes the central part, which is definitely governed by this strong MDM engine. And after that, all your analytics, whatever you're doing in terms of decision making, will be absolutely perfect.
Beautiful explanation, Rohit. Thank you so much for that. And Bridget, in healthcare, we use lots of provider, patient, and location data instead of customers and products. So, why is MDM even more critical here?
So as he mentioned, regulations, right? In addition to regulations, I would say my personal experience across the nation has been that it allows organizations to be able to move data in a standardized format more quickly across their internal organization. As Rohit was mentioning, the master data management system, or the tools, they're all made up of different kinds of capabilities. Typically, you'll find that whether it's with a health system or a payer, an HIE, a healthcare information exchange, a high-tech company in the healthcare industry, they're going to have those master data management tools that are physically present within what's typically known as the data and analytics area of their organization. And so the reason why it's so important is because you think about the ability to provide the patient care and to be able to accelerate the ability to move data from, for instance, the credentialing systems or the CVOs or the payer enrollment systems or the medical staff office organizations and on, as well as the HR areas if you're employing, providers or caregivers, and EHRs, being able to bring that data together quickly, real time, being able to then bring that data into an area that can distribute the data across the entire organization, and being able to then send that same unified standardized data outside of the organization for the various different insurance organizations, such as our payers, send the data over to the healthcare information exchanges. It creates what in the nation you're hearing so much talk about: interoperability. So in healthcare in the United States, the day and age is here where we have to be able to provide data in a seamless and accurate way, in a manner in which everyone's speaking that same common language. And that's done through master data management. And it's a distinct set of capabilities that can only be delivered by introducing master data management to an organization.
Thank you so much for that, Bridget. And you touched a little bit on credentialing, and I know credentialing is like the powerhouse for a lot of this provider data. So thank you so much for bringing those wheelhouses in as well. Those are super important also. So segueing into some more different questions, between the new federal rules and the rise of artificial intelligence, data governance is about to change forever. So can you talk about some of those ideas around the National Provider Directory, some of those cross-industry governance models? What do those things mean for you and our audience here today?
I can answer that one. It relates to what's happening in the United States in particular, we see that there's a lot of information that's out there on what's known as the CMS 0057. Most of the content that's out there focuses on making data available outside of your organization by way of APIs. I like to use the illustration that the APIs are literally like the pipes, right? But without having the actual liquid, the water that flows through the pipes, it doesn't matter. And so master data is literally that cleansed, beautiful water that's delivered throughout the organization and across the nation. And so when we think about things that are happening where organizations have been working to be ready for the CMS 0057 as an example, in order to really be able to enable those API requirements, you have to have the data. And you can't just send the data from your EHR and think that's going to be sufficient, because the data has to be sent in certain types of data standards, meaning that in the United States, organizations are working to standardize the language in which we send data. And that language, as was mentioned, as Kay, you mentioned, is the fast healthcare interoperability resources, or the FHIR language. That particular language is made up of common terms and expressions. And so what we're doing in master data is that the organizations that offer master data management solutions, the ones that really understand the industry, they're making sure that that data is delivered according to the FHIR standards, not just the APIs, but the actual underlying logic that is within those different APIs. That's the big differentiator. You also talked about the National Provider Directory. Even though the directory is something that's forthcoming, in order for us to be ready across the nation to be able to support a national directory, organizations have to be able to have access to the data elements, each element that needs to go to the directory. They need to be able to send that data in a timely manner, and they need to be able to send the data in a standardized manner. And so if an organization does not have master data management capabilities, if they don't have each of those capabilities that Rohit mentioned that are brought to you within a tool stack or a system that's specifically designed for master data management, they'll be inefficient in being able to meet those types of requirements that you mentioned, Kay.
Thanks so much, Bridget. And Rohit, what's some of your feedback as it relates to implementing some of those tool stacks, or some of those AI driven data? What is your feedback on that as well?
Well, I think first of all, great explanation by Brigitte. Really loved the answer. Well, if you talk about the AI and automation, why all those initiatives are so dependent upon master data management. So, as I explained earlier, that any AI initiative ultimately it's banking on a clean data. And if you're talking about artificial intelligence, Gen AI, agentic AI, whatever we are developing, ultimately the goal is to make sure that we help ourselves in a quick decision making. And if that decision making is banking on a wrong data, then ultimately you're compromising your decisions. So it's essential, it's imperative that you have a clean data set on which your AI, your forecasting, or any kind of analytics is banking upon. So as I said in the beginning, that master data management is the most important data pillar right now in the industry, because the kind of explosion we are looking at and the kind of initiative that we are seeing in the world related to the Gen AI and agentic AI, it becomes extremely important to fix our data. And I'm sure that if people who are in the organization understand this importance and fix this data, you will see that all the decision making related to AI and analytics, that will be super fast. That will give you the right results, and you'll be able to see the remarkable improvement in the overall efficiency and the correct decision making. So absolutely essential to have a good clean data, and that can only happen when you have a MDM in place.
Amazing. I think that's a really great explanation from the both of you. Having clean data, provider data, patient data, member data is super important and super vital. So it sounds like the proof is already here. And so let's just see what's going to happen with FHIR and MDM working together in real life. So that kind of segues us into some real world success stories, right? So let's highlight a few examples of some organizations putting MDM into action. Bridget, I'll start with you first. What does it look like to put some MDM real world examples in organizations, and how would organizations go about implementing that plan to MDM or even fire, if that makes sense?
Okay. So let's see, without naming names, you're more than welcome to take a look at my LinkedIn profile for the mix of the past clients that I've been able to help support across the nation. I can share with you that the principles that we're talking about today, so not only the principles of master data, but also the capabilities that Rohit has mentioned, right? Being able to profile, to be able to match and master the survivorship, all these different capabilities that are part of an MDM tool stack, combined with the different sources that we were talking about. When organizations have those things, it doesn't matter if they're academic medical centers, if they're health systems, if they're insurance payers, or healthcare information exchanges, or healthcare technology companies that are having to bring together data from all sorts of their different customers. In every single one of those situations, they have to have the master data management tools, because what it allows them to do, as I mentioned before, is to seamlessly send data. And so some brief examples I would share with you that over the last 10 years of doing this day in and day out with teams of individuals, the commonalities that I see are certain key domains. And what I mean by that is there's certain subject areas that every single healthcare organization has to have. Most commonly, you'll see them wanting to implement what's known as provider or practitioner master data. That would be the type of data that is about the providers, their demographic information, the locations that they're tied to, the different affiliations that they have. It allows organizations then to seamlessly take the information about their providers and make it available to their internal directories where other providers can find them. It allows them then to push that clean data in real time out to the directories where patients in their communities can find them. It allows them to be found within various different AI tools as people are searching for providers. It allows them to be able to provide better patient care because the data that's found within the EHRs is clean, it's timely, it's up to date, and clinical care team members can find who they're looking for. And then I would say in the last maybe 5 or 6 years, there's been a major shift. And it's with the interest from our ACOs, our accountable care organizations, our value-based care organizations, our VBCs, as well as our population health management teams. So again, ACOs, VBCs, Pop Health, those areas are now starting to see, oh, master data allows us to be more competitive in the markets that we're trying to serve. It allows them to see where there might be gaps in looking for providers that provide certain kinds of care in their areas. It allows health plans or health systems to, health plans to be able to display accurate information about providers to their different networks. Some of the things that I'm also sharing with you have very, very strict regulations that are coming in the next several months and years, where the data is going to start to have an impact on whether or not those organizations survive versus thrive. And so that's provider data. Organizations also see great benefit in having beautiful location data. So again, patients can find what they're looking for, but that the operations within an organization can run seamlessly using location data. And then, as you just mentioned a little bit ago, Kay, you mentioned patients and you mentioned members. And so patient master data, not a new concept. People have heard the expression EMPI in the past, but patient master data as well as member master data. When you think about member master data, you'll know that organizations such as Da Vinci are publishing different types of data standards. The Da Vinci standards give recommendations for how you would then manage the insurances and the coverage information so that you can expedite use cases like prior authorization. And we all know that in the next several months, there's going to be some very strict requirements associated with being able to move data in a more timely fashion as it relates to prior authorization. And I think that, Rohit, given what you shared with us, you were going to touch a little bit on reference data. Reference data is a powerhouse, so I'll give that to you.
Absolutely. I think, as you said, the reference data is definitely one of the most important aspect when you talk about in a healthcare master data management, because there are different systems used in healthcare industry, and every system might use some different codes, and those codes are needs to be interrelated to each other. That's why the reference 360 becomes extremely powerful, extremely important, because otherwise you'll not be able to identify, let's say, if a medicine is called with a different name in one system, and that is called with a different name in another system, that can be it can be a same thing, but if you're not able to relate, then you're bound to get confused. So it's very, very important that you maintain a reference 360 where your all the codes can be related to each other. You can have a mapping with them, and that's why the reference data is very powerful, especially when you are making a 360-degree view between a provider MDM, between a patient MDM, between a location MDM, and your product MDM as well. Because even your drugs data and your medical devices data, that also needs to be mapped correctly. So that mapping, that centralized mapping, can only be complete when you have a reference 360 in place. Brigitte.
Thank you so much, Rohit. I think those both of those were great explanations on those areas of MDM and how member data, patient data, provider data is very, very important and vital into having a successful MDM and reference data plan. And one follow-up question, Bridget, what design choices make this kind of longevity possible?
I love that question. I tell you that because so many times I'll come into an organization to help them out, and they've already chosen a tool stack. And the tool stack might not meet the needs the organization actually has. Or they may have chosen to save some money, and they've chosen to not use an MDM system, and they're attempting to use different types of technologies to instead put together data thinking it is just about matching records. And so I like to think of MDM as an asset, right? You're trying to create a product that the organization can use that can last through the time. And so I have clients that have been on the same tool stack, same system, MDM system, for over 10 years. And when you think about the day and age that we live in, if you're able to make a decision as it relates to technology that can stay in an organization for 10 years because it's able to integrate data to perform the functions and make it available downstream to a ton of consumers, that's a decision that should go on the resumes and the CVs of the executives that made that call. And the reason that that's a distinguishing factor is because they don't start with choosing tools and bringing on contractors, but they start with the end state, the design in mind, meaning they go through the process of looking at what are we trying to produce, which of those different domains, as I mentioned, provider, patient and member, location, et cetera, which of those are we trying to produce for our organization? How many different types of data sources are we going to need to eventually bring in over time? What kinds of data elements are we going to need to make available to our customers? Are we working to advance interoperability in the nation? And if so, what data model design are we going to use? What kind of support do we have from teams to help support the data stewardship and the data governance? And when you sit down and you put the strategy in the front of the work effort, then you can start to see the size, the depth and breadth of the work, and you can start to then determine what kind of a tool stack or what kind of a MDM product you're really designing toward. And you can start to work it backwards to break it down. And so there's different types of frameworks that we'll teach clients. There's different types of templates that we use when we're working with clients that help them to make those strategic decisions so that they can be as conservative with their capital and operational dollars up front in order to save their organization added expenses, but while advancing the way that they use data, maturing the way they use data, and making the data available across the nation. And so really it's an art form in developing master data for an organization in order to have that longevity and to really build it out to be as mature as Rohit mentioned, even doing things like master reference data for an organization.
Awesome. I will co-sign and say that it's definitely an art implementing these frameworks. And Bridget, one of your signature frameworks, Getting Started, defining the MDM asset, is used nationwide. And what's at the core of that approach?
There's a process. I think the consistency, as I mentioned, is making sure that you understand what you're designing toward before you choose the particular product that you have in mind. But then it's also looking at how do you do the development work in a way in which you're benefiting the largest number of customers at one time. And so what I've found to be the most effective way in doing so is by putting together what we call a heat map. And that's something I discuss with different consulting events. But in essence, it's a framework that can be repeated over and over and over, where you collect the feedback from your stakeholders who have an invested interest in master data. You collect their feedback, and then you're able to document down to the attribute level, in fact, so that you can see where there's the highest concentration in your organization for interest in master data. It allows your development teams then to prioritize doing development efforts in those areas that are going to benefit the largest number of stakeholders or consumers. You can then introduce those data elements to consumers, and from there, you start to cascade in future releases of the data so that you really can implement what's known as a master data management program.
Beautiful. I love the fact, and for our audience, as far as the MDM heat map goes, can you break that down a little bit further for those of
Yeah.
us in the audience that are not as familiar of what the MDM and heat map may refer to?
So at a high level, it's a kind of a proprietary framework that I created a number of years ago because I've worked for organizations that by the time they bring us in, Rohit can totally attest to this experience, by the time an organization says, we have to do something about this situation, they're already up to their knees in data problems. And at that point, they have all sorts of leaders and providers and consumers that are demanding that they have this central source of truth for data. In essence, you end up having lots of different people or leaders you're answering to, right? And in order for you to get their feedback, their requirements as quickly as possible and start to move to doing the development, then it's a template that's been put together for clients where you can collect the feedback from the different stakeholders. They can then provide feedback as to which different attributes are the most important to their business use cases. As they populate that, they can either do it through workshops, they can do it through virtual events, they can do it through a variety of different meetings. But at the end of the day, they produce an artifact. That artifact can then be used as the universal, what we call a backlog, which gives the prioritization for the organization for where they're going to start doing the development efforts. And they can start to break the work down into measurable pieces. And so that particular component of developing master data allows for an organization to be as conservative with their dollars as possible while giving the greatest benefit to the company.
Awesome. That makes a lot of sense. So it sounds like it's not just always all about technology. It's about more so sequencing. You have to define the data assets first, then applying the right tools. And I think that's a message that every executive needs to definitely hear as well. And so leading into going beyond kind of like provider data, healthcare MDM now spans far more than providers as we've already discussed here today. So where are organizations seeing the next big wins? Rohit, I'd love for you to take that question first.
Yeah, I mean, the way the industry is changing, so definitely the provider data and the patient data, that becomes absolutely, essential. But apart from that, I feel, the location master data management, that's also an area which is, gonna be extremely important. What location master data management exactly means, I'll, give some explanation. Imagine, let's say if you are a patient and you want to visit a hospital, and if you're not getting the right address information, if you're not getting the right geocodes, you might not be able to reach that facility. Similarly, if you are a provider and if you are being tagged to a facility where you have to, serve care a patient, and if that location information is not correct, ultimately it's going to hamper the care. So it's imperative to have a location master data management so that all your systems, that whether the information is there in EHR, CRM, billing, all those different applications are maintaining your location information. So it's important that you have a centralized master data management for location as well, apart from provider and the patient, so that you are absolutely in control with your facility data. I mean, the ultimate goal is always to make sure that there should not be any incorrect address mapping to your provider or to your patients. So ultimately, it's going to suffer the care, it will suffer the experience. So it's important that we realize the importance of location master data management as well, apart from the provider and patient in generally what we do. And it's not that easy. I mean, honestly speaking, just saying that having a location master data management, you have to make sure that there are some key elements that you have to manage a proper location hierarchy. You need to have the data model in place where you can map the hierarchy. You should know exactly like for which particular health organization is following and is undercoming which hospital, in which department, which ward, which room. Exactly the complete flow needs to be maintained in the system. Apart from that, you need to do a proper address standardization. What address standardization means is that you need to have consistent address throughout your system so that you maintain the right geocodes, right postal code, so that anybody, even whether it's a patient or whether it's a provider, they can reach to that particular place on time. Because ultimate goal in a complete this journey is to make sure that you are giving the supreme care to your patients, because here it's not just a loss of money like in other industry. Here it's a loss of life. So every small information is absolutely critical, and that's why I say that the clean data in healthcare is absolutely essential. You need to have unique identifiers for your location. You need to map them. You need to exactly know that whether this facility ID is correct or not. So in a way, it's a whole and all different vertical altogether. But location master data management, I feel that it's imperative. It's very, very important apart from the provider and the patient MDM, which we see in healthcare.
Thank you so much for that response, Rahid. And Bridget, we've talked we talked a little bit about other areas other than provider data. So what is your feedback here around healthcare MDM and how to implement that as well?
I was going to mention that I couldn't agree more on the comments that Rohit made about how it actually does affect patient care. I've physically been with different clients on site where the decisions that are being made in the organizations truly affect the ability for providers to find other providers or patients to find providers. That's actually the original reason I got into this space, is because in the United States, there weren't standardized processes to be able to exchange this kind of data, and lives were truly being on the line in situations where, had they had access to the right types of caregivers, had they had access for a provider to find another provider in a certain specialty space, it would change how people who need access to healthcare can get access to healthcare. And so when we think about location, he talked about location domain. He mentioned also reference data. I've had the privilege of working for some of the biggest healthcare insurance payers in the world, doing their reference data and helping design reference data standards. And that is no small undertaking. But I think the big game changer in the United States in the last few years is that more and more organizations are starting to pay attention to the fact that we have those healthcare the FHIR standards, the various different implementation guides, IGs, people call them. And so when you look at those different IGs out there, they're designed for certain use cases. And when you're looking to do design work for members and the members' coverage that they have for their insurance information, being able to expedite the delivery of that so that they can gain their prior authorization in a more timely fashion, being able to move the data along through the whole entire care journey, that's done through master data. We have clients literally that have been at the forefront in the nation in changing how data is used. And when they look underneath the covers of the tool stack, there's master data that's delivering those things. And so we talk about the location data, the member and patient data, the provider data, as we've talked about, and the reference data is the key that binds it all together so that you're able to deliver that seamless data across the nation and within your own walls of your own organizations.
That's amazing. I think it's really important to understand what happens behind the scenes and how a lot of this gets delivered to the forefront, especially we're all patients. So it's really important to understand how that gets where it needs to be. And so I think that's exactly where killing the clipboard comes in. And so replacing manual entry with trusted shared data. Bridget, can you share a little bit around the Killing the Clipboard
Mhm.
initiative and what that means for us and could mean for executive leaders around the world?
Yeah, I love that. There's been publicity on it, not enough, but when the work effort around kill the clipboard came out, and you look at the organizations that are part of that effort. So if you need to look it up, look up the expression "kill the clipboard." When you look it up, you'll see that there are certain insurance payers participating, providers participating, as in like health systems are participating. And then there's certain healthcare technology companies participating. You want to know what 90% of them have in common? They already implemented master data for the various different domains that we're talking about today. So you look at the list of 100 plus different organizations and you look, what do they have in common? They already have provider master data. They have patient and member master data, location master data. They've actually been on those journeys for upwards of 10 years. They've been using that data and they've been paying attention to the standards around how to exchange the data in the common language for the last number of years. And so while the media portrays that this is all about FHIR and implementing FHIR servers and moving data via APIs, the true commonality that all those organizations have had for almost a decade is that they've already had master data and they've already been using it. And so as the rest of the organization looks upon them and looks upon them to be setting the example and the role models for the rest of the nation, the little secret piece is that they've had master data all along. And that's what's given them the advantage to be able to sign up for initiatives that are very visible across the nation, is because they're already close to being done.
Beautiful explanation. I think Killing the Clipboard is an amazing initiative from going from manual to implementing new technology or new frameworks. So thank you so much for that, Bridget. And Rohit, Gardner and Forrester rank MDM vendors each year. What are some of the things that they do get right?
Well, Gartner and Forrester, they are renowned analysts. So I think, and for everyone who's new into this healthcare domain and wants to, use a master data management tool, so these analysts can give you a quick solution, a quick report. It's a very detailed report that which are the top vendors who can, provide this master data management tool. So every year, Gartner comes with a magic quadrant. Forrester delivers their report, and they publish that among all the vendors, who are the leading vendors, who can give you the master data management implementation. And how do they go about it? Well, they generally have a rating mechanism. They judge them into different parameters. Let's say if you talk about a typical master data management tool, what it should have a capability to profile the data. So they will rate them that and let's say imagine X vendor, that how much they fare in a data profiling capability. Similarly, they will rate them in their data quality capability. What's their rating? Then they will see that in a MDM, the deduplication is a very very important activity, and there are different kind of theorems, different kind of ways through which you can do the deduplication. So they will again judge you on that parameter, how strong your duplicates and deduplication logics are. Are you still doing the traditional way of doing matching, or you have adopted artificial intelligence to do the reduplication? So that's another parameter. Apart from that, how strong you are in the governance, how strong you are in overall, the dashboarding and the integrations with your different systems, and are you able to do the regulations? So all those parameters, they play a huge role, and accordingly, Gartner and Forrester rates different vendors on this scale, and whosoever rates highly gets the highest points. They place them in a leader quadrant. So it becomes very very easy for anybody who wants to choose an MDM tool. They can simply see the report and see who are the leaders in that particular space, so they can go for it. But having said that, you don't have to blindly follow those reports, because ultimately it's a generic way of reporting. It's giving you a fair idea that who are the top vendors. But in a nutshell, if you ask me, because I have been implementing master data management from last 20 years, so I always rate the tools as per the features and the use case you need. So you need to know exactly what are you looking in that tool. So let's say for a layman, probably for somebody, Apple iPhone can be good. For somebody, a Samsung is good. So it really depends upon what you need. But in general, if you have to see that what are the tools which have some basic parameters, then Gartner Forrester reports definitely will do the job. And apart from that, there is another report which is making sure that all the MDM tools are covered. That is International Institute of Analytics. So that is also giving you a quick scan of where these tools are. But having said that, as I told you, that it first you need to understand and analyze on your own that what features you are looking at, what are your use cases. Depending upon that, every tool will have their own way of faring. So their ratings can change depending upon the features you are looking at. But to answer your question, Kay, so these are renowned bodies, especially Gartner and Forrester. Everybody knows their name. We just simply need to access their magic coordinates and their reports, and you will be able to figure out that which are the top master data management tools which are applicable in this domain.
Thank you so much, Rohit, for that. I'm so sorry I was on mute, guys. And with every great report comes some sort of misses. Bridget, what are some of those things that are missed in some of these healthcare applications?
Well, I love that he called out the examples of the feedback that you get from Gartner and from Forrester. I think that's the first baseline, is that if you're going to try to do master data and you're not going to use a tool, that's a problem. So if you're an organization that's already started on the process, or you've found that you're consuming too much by way of subscription services for certain tools, it's going to get worse because you're not using an actual MDM tool. or if you're trying to use something like an open source MDM that is made up of maybe data models that are from other countries, that's also a problem. So fundamentally, start with those examples that are in the Magic Quadrant, but they don't cover various different commercialized MDM solutions that are specific for healthcare. And so, as he mentioned, right, they look at different capabilities, they do the ranking, they publish them, but they're also publishing that for all different kinds of industries, right? It's not just for healthcare. And so when you think about, okay, well, I'm a healthcare organization, so what do I choose from? That's where you want to look at the different kinds of products that are available in the landscape that have those same capabilities that we've talked about, and they show clear expertise and background in the healthcare industry, meaning that they understand the language that we're speaking. And if they have different kinds of data models that are in there, they're models that are keeping up with where we're at in the nation in terms of being able to exchange that data from an interoperability standpoint, and that they cover all the different domains that we've talked about, that they're not just positioning themselves or selling themselves as an EMPI or just a provider master solution, but that they understand all those different domains that we've spoken about thus far: provider, patient, member, location, reference data. That's going to tell you that, number one, they've got the capabilities. Number two, they understand the industry. Number three, they're keeping up with where the industry is going, so that when you use them as a tool or a partner, technology you bring in, you're already in a position where you're able then to enable it with your data and move it forward.
Beautiful. Thanks so much, Bridget. And so looking ahead into 2026 and even further out, 2027, and with all the new CMS requirements and reimbursement changes, what should our leaders be looking and doing right now?
I can go first on that one. What I'm seeing with clients in the nation right now, they're very concerned about the One Big Beautiful Bill initiative. They're very concerned about that from the vantage point that it's going to impact the ability for them to get certain reimbursement rates. There's a shift in the reimbursement rates from a CMS standpoint for both Medicare and Medicaid. Certain states in the nation are being impacted more than others. And so when we think about the mix, the patient mix, and those that are going to be covered by what kind of insurance, right? Then organizations who are in the value-based care space or trying to position themselves as an ACO that offers services to their different providers, they want to be able to be competitive in the space. And that's where being able to have the technology in the analytics area for master data management is going to position them to be able to remain or gain that competitive edge.
And Rohit, do you have anything to add to Bridget?
Yeah, exactly. I mean, I kind of agree with Bridget. But yeah, just to add on that, I think that more initiatives will definitely come into this healthcare industry, and I feel that artificial intelligence is going to be very, very big because these days, especially when you're when any patient is interacting to the healthcare organization, that initial contact, if that is smooth for a patient, then obviously their whole experience is that doesn't suffer. They'll be able to map their doctors correctly. They will be able to map that which facility they want to go for. So that initial interaction, it's very, very important, and that's where AI comes in. And we have bots right now, which are taking control of all the customer care. So I think the healthcare is definitely will see a huge leap and bound shift in terms of how we are going to utilize this data, and we'll see that AI is going to make a big impact. But again, as I said in the beginning, AI will only work if you have the right data. So you have to first fix your data, and then you can see the magic of artificial intelligence in healthcare as well.
Thank you so much, Rohit. And leading into one of my last questions for the both of you, actually, if you could give healthcare leaders one piece of advice to lead into the future, what would that be? Bridget,
I'll do
feel
it.
free.
I'll go first. I'll do first. So I get one sentence. It's going to have an and in it. Number one, I would say make sure that you have team members' resources that are actively keeping up with where the nation's going for data standards. And when you're selecting your technology for master data, make sure that you are doing so in a strategic fashion so that your selection is one that can sustain years throughout your organization.
Well, I'll add to Brigitte. I really love the points you made, Brigitte. But I feel that in a healthcare industry, I feel overall, as I said in the beginning, this industry is different from other industry because if you don't have the correct data, you're actually impacting the patient's or human's life, which is way more costly than any money loss. So in this industry, data, having a clean data, having a right data is more important than any other industry. And that's why I also strongly feel when you're talking about the Gartner Magic Quadrant, that there should be a dedicated quadrant, there should be a dedicated analysis for healthcare master data management because the impact is directly related to patient's life and patient care. And I feel that is should be the most important criteria to just this industry. And that's where this role of master data management becomes even more important. So I strongly feel that every organization, whosoever is working in this space, should have the MDM tool. But choosing the right MDM tool is also, it's not a cakewalk. You have to be very calculative in understanding that which is the right tool and how to select that right tool. You can't just go and choose any. So it requires a analysis, and definitely you can get reports from Gartner Forrester. But apart from that, Brigitte is there, I'm there. If at all you need any help in terms of getting the right consultancy, we can truly guide you that what is the right MDM tool. But having that tool is extremely important, especially in the healthcare industry.
Amazing. And we're all patients, and I think it's very important and vital to understand that. And so, with that being said, I think we've covered a lot of ground today. So I want to open up the floor for Q&A for our audience. So I will go into the chat right now. And our first question is, unlike the UK's structured care tiers, the US healthcare system allows patients to navigate freely between levels of care. As AI and data collection becomes more central to healthcare delivery, how do they influence or potentially undermine this patient autonomy? Furthermore, does the adoption of master data management systems heighten competition among hospitals? And are rural or underfunded facilities being left behind due to cost barriers?
I'll take the second half of the question. So for the second half of the question around the adoption of master data, does it heighten the competition? Absolutely. Absolutely. When an organization has master data, they're at the top of the competition, and it's hard to catch them because once they have that in place, they're able to move data more seamlessly. They're able to manage the data quality of the data of their organization, and they're able to exchange it across the nation more quickly. So competition, no questions asked. That's why they're already in the top tier organizations in the nation. And then the second half of the question was, does it cause difficulties for those that are from rural or underfunded facilities? Are they being left behind? And I would share with you that most of our rural healthcare organizations in the United States are part of a larger framework. And so if those organizations maybe are independent provider practice, they might be part of something like an ACO. And so if they are part of those larger organizations, I mentioned that more and more in the last few years, those same kinds of organizations like ACOs are also starting to take an interest in instituting master data so they can make their services for their providers more attractive and more competitive, and helping them sustain their positions within their communities.
Beautiful. Thank you so much for answering that question for us, Bridget. So I'll take another question from the audience. Can either of you speak to how data recency is addressed in the MDM, given that healthcare has very few sources of real time data, since real time data was mentioned earlier in this discussion?
Yeah, I can take that question, Brigitte. Well, I think data recency is very critical aspect in this journey, because we are talking about disparate systems over here. If you're talking about real time or near real time data integrations, like you have to connect to source systems like EHR, CRM, CRB, and they all use some kind of APIs and event streams. So when a record is is created in a source system, MDM Hub automatically synchronizes those changes in a near or real time. So yes, there are ways through which you can integrate with these systems, and you can maintain the data recency.
Beautiful. Thank you so much, Rohit. And are there other open sandbox areas that we can use to learn more about how data is packaged and expedited through a system?
So I think that question might be geared towards something that's known as terminology services. There are different kinds of products out there that will bundle different types of terminologies or code sets or value sets or ontologies and make it available. A lot of those are, if not all of those, are at cost. There's a cost to access that kind of data. And so the alternative approach that an organization can use is, as I mentioned before, those fast healthcare interoperability resources, the FHIR implementation guides, the FHIR IGs. They contain different types of code sets and recommendations for different code terminologies that exist, some of which are complementary and accessible, and they'll tell the person who's developing master data where to go to get that information. But then you also have to keep in mind some of the more advanced ones are proprietary, and they do require some licensing agreements. So before you start a project in master data, oftentimes you want to check to see if your organization already is paying for access to those different proprietary or licensed code sets, so that you can take advantage of that data or those services.
Thank you, Bridget. And another question from our audience, when selecting a new credentialing platform, who do you recommend to bring in as stakeholders to help evaluate in addition to credentialing and providing enrollment, and also IT?
I'll do that one real quick because I know we're running shy on time. Definitely. So when you're looking at bringing in a new kind of a credentialing system, you want to bring people to the table that are also from the data and analytics side, or have someone help consult with you to tell you the types of technologies and capabilities that you should have in that type of product, because then it will allow your organization to get ready for being able to support something like master data, making sure that that credentialing product will integrate really well in your organization. And they're not all the same. So you definitely want to make sure that you have the support before you choose a new credentialing system.
Beautiful. And last question from our audience. Do you fear the access to monetizing patient data for commercial gain with the Kill the Clipboard initiative, when there's already a transparency and asymmetry of information between physician and patient, making it physician rather than consumer driven?
I'm happy to take that one. I would say that, as Rohit mentioned, we're both in this because it changes the lives of patients. And so the more we can do to standardize data to really the change the nation in terms of how patient care is given and how providers find other providers and provide that patient care. At the end of the day, That's the purpose by which we do what we do. And so the monetization, those types of things, there will always be downsides to everything. But at the end of the day, we're in this industry and we do the hard work we do because we're improving the patient care that's delivered across the nation.
Amazing response. Well, a huge thank you to our speakers today, Bridget, Tebow, and Rohit Verma. And thank you all for joining us today.